I'm back! Menopause Barbie here, resuming our series on menopause, your management, your way, now and for the rest of your life. Today we're picking up where we left off in the last tutorial. We are in the middle of our discussion on synthetic estrogen plus progesterone for menopause. Now, in the last tutorial we designated dosage as a variable in the different types of estrogen plus progesterone products that are available to you. So today we're going to discuss only the higher dosage options of estrogen plus progesterone products. You're going to find this material on pages 142 to 146 of the book and pages 33 and 34 of the outline notes. Now, you might be thinking, why in the world would I or anyone want a higher dosage hormone option for menopause? But you see, it's the shunning of generalizations that keep you in the dark about things that put you in control of your menopause. I hate that word generalization. See, most people react with fear to terms like higher dosage. But today I'm going to give you the facts. And once you know the facts, knowledge is going to replace your fearful reaction to the generalization, and you can make an informed decision about what's right for you. So let's get started. You'll recall from the last tutorial that the higher dosage estrogen plus progesterone options refer to hormonal birth control products. Now, I know you might be saying, Menopause Barbie, are you confused? I don't need birth control, I'm old. I need something for menopause. Well, I'm not confused. You have to remember that you transition into postmenopause. It's a process that takes time. Enough time to get pregnant in the process. Do you remember the phases of menopause? There's pre-menopause before you start the transition. There's post-menopause when you finish the transition. But in between those two phases is peri-menopause. And peri-menopause is perilous. You see, that's when you aren't quite finished with your reproductive potential, even though you have some of the symptoms of impending menopause. And perimenopause can last from 2 to 10 years, and that's when you can still get pregnant. And the probability of twins skyrockets. You see what I mean by perilous? So there is definitely a place for a discussion of birth control in these tutorials on menopause. Now, perimenopause is also when your periods are really crazy, and birth control options take care of that too. And they do that by making your periods really light and really predictable. So now that I've got your attention, let's talk about birth control options for managing perilous perimenopause. Now, if you're already using a hormonal birth control method when you enter perimenopause, you may not even know that perimenopause has begun. And that's because all of these birth control methods contain both estrogen and progesterone, which means they mimic your cycles and they provide enough estrogen to mask all the symptoms of perimenopause. So if you're already using a birth control method like a pill or patch or vaginal ring, when you're about 50, you might want to just continue using it for a few more years. All of the birth control options for perimenopause fall into the lowest dose category of hormonal birth control options. They are still low dose birth control, but they're all higher dosages than the hormone replacement therapy that is strictly for menopause. So that's why we call them the higher dosage. And see, that's the big distinction. You need higher dosages to prevent pregnancy than you do to prevent hot flashes or osteoporosis. But With higher dosages come higher risks. And the younger you are, the higher the dosages necessary to alleviate your symptoms of menopause. So these higher dosage options in the form of birth control really make sense when you think of it that way. So let's talk about each category of birth control options and delineate all the specific risks for each of them. First, we're going to start with birth control pills. So here I have some birth control pills. This is called Yaz. Okay, now birth control pills come in a monthly package. They're designed to mimic a 28-day menstrual cycle. But the last few pills in every packet are fake or placebo. So these brown pills in this packet are fake. So what you do is you take a pill each day, and then you have your period toward the end of the package when you get to these fake pills. And that's because when you take the fake pills, both your estrogen and your progesterone drop off, and that is going to start your period. Now, when it comes to birth control pills, the dosage of estrogen and progesterone in each pill may vary to mimic your body's production of these two hormones over the course of your monthly cycle. And we call that kind of pill triphasic. That means 3 phases. So here's one called Trilogest iron. Fe is iron. And what you see here is a pill pack that looks like this. So these pink pills here have 20 micrograms of estrogen in them. The yellow pills have 30 micrograms of estrogen in them. And the blue pills have 35 micrograms of estrogen in them. And they all have the same dose of progesterone. And then when you get to the brown ones that are fake, that's when you have your period. So you see there's different colors for different dosages. The 3 phases of hormone dosages here cause the lining of your uterus to thicken and then shed, just like it does naturally when you're having your periods without any birth control pills. Now, other birth control pills have the very same quantity of estrogen and progesterone in all of the active pills. We call these monophasics because the pills are the same except for the fake ones at the end of the pack. So here we have a package of low estrogen Fe, again iron, and what you see here is you see that all the pills are pink except for the ones at the bottom. So all the pink pills in this package have the very same dosages of estrogen and progesterone. And then the white ones at the bottom are fake. So these are going to cause the lining of your uterus to shed when you start taking the fake pills too. But the lining of your uterus will not have built up much. And your period will be very, very, very light. And that's because the estrogen and progesterone is equivalent, as far as ratios are concerned, in every pill. So there's no opportunity for your uterus to respond to estrogen by itself. Now, some birth control pills are designed so that you don't even have to have your period every month. And we call those extended cycle pills because you have fewer periods with them. Some give you a period only every 3 months. So here I have one called Seasonique. And look at this package. You see this? This is the package of pills that you'd get. This pack is kind of like a club sandwich. It's like 3 layers. So you have 3 different layers, one for each month for a total of 3 months. So this first layer here, you'll notice has all blue pills. Each pill in this first layer contains the same dose of estrogen and progesterone. The estrogen and progesterone in them does not change. Then you have the second layer. Same situation. All of these blue pills have the same dosages of estrogen and progesterone as all the other pills. And then you get to the third layer, which is for the 3rd month, and you see the very same thing until the very last week, which in this case is going to be the 12th week from the time you started this pack. And all these yellow pills are fake. So that's when you finally have a period. And in this case, you're going to end up having a period every 12th week. So you go for 12 weeks with no period, and then boom, you have your period. And There are even some birth control pills that enable you to skip your periods, period. In other words, you never, ever, ever, ever have a period. It's like that what is it, Taylor Swift song? You never, ever, ever, ever have a period. So that's how they're designed. So here we have one called Amethyst. Now, this one used to be called Librel, but now it comes in the generic form, and now it's called Amethyst. So that's what we have here. And with this one, what you have is all the pills in this pack have the same dosage of estrogen and the same dosage of progesterone. Okay, they don't change. They aren't the Triphasic where every week the dosage changes. They're all the same. And you see, there are no fake pills. These are all identical. And when you finish one pack, you just open another one the very next day, and you continue taking a pill. And you take a pill a day, pack after pack after pack, with no breaks. They'll give you packs and packs and packs, and that way you never have a period. Now, of course, based on what you learned in the last tutorial, you know that this one represents a continuous regimen. So you just take your pills, but you never have a period. And this is the most common regimen for peri-menopausal women, because your periods tend to be wacky, and one of the goals is to settle everything down. Now, I know, you're about to get your panties in a wad and shriek, but menopause Barbie, don't you know you have to take a break from the pill and give your body a vacation from all those hormones? Well, you see, that's one of those misconceptions gone awry. No, you don't need a break from the hormones. And if you do take a break, it will definitely not be a vacation for any aspect of your being. I promise. Instead, all those symptoms of menopause will return with a vengeance, and you're going to go from being a humble menopausal woman, like Barbie, to a hellish menopausal witch. It's going to happen in a flash when you stop and take your little vacation. That's the way it works. So if you choose to use continuous birth control pills, just sail along happily and quietly for as long as you can. The one common feature of all birth control pills is that they prevent buildup of your uterine lining. And that's because they contain estrogen plus progesterone. Okay, these pills all contain estrogen and progesterone. I hope you remember that I taught you about the importance of preventing continued thickening of the lining of your uterus, which is what happens if you take estrogen by itself. Birth control pills take care of that. They either cause your lining to shed, or they prevent it from thickening in the first place. And either way, you accomplish your goal. So birth control pills are going to cover all the bases for what you need to achieve. You're going to prevent pregnancy. You're going to prevent thickening of your uterine lining. You're going to mask all your symptoms of menopause, and you're going to prevent osteoporosis. Now, all this sounds just dandy, but there are some risks. And that means birth control pills are not for everyone. For some women, there are some absolute deal breakers for taking any kind of birth control pills. So you are not a candidate to use birth control pills if you have any of the following: a blood clot, a pulmonary embolism, which is really a blood clot that has traveled to your lungs, or a stroke, or a heart attack, or high blood pressure that isn't controlled with medication, or significant diabetes, or breast cancer. So if you don't find yourself in that list, you may possibly use birth control pills for one-stop shopping during your perimenopause. But another big deal breaker is you cannot smoke. I mean, not at all. You got to throw out those cigarettes. This deal breaker takes effect at age 35. And the older you are, the more risky it becomes to smoke if you're taking birth control pills. Now, smoker, when we say someone's a smoker, we include all forms of tobacco use. Cigarettes, cigars, pipes, and it includes use of marijuana and other non-tobacco products too. Smoking while taking birth control pills puts you at high risk for blood clots, stroke, and heart attack. Not worth it. Not worth it. So, if you're not a smoker, you might be able to take birth control pills until you're 55. Now, why would you let cigarettes rob you of the smooth transition into menopause that birth control pills can offer you if you choose to do it that way? So just get rid of the nasty cigarettes. Now, another deal breaker is liver disease. Now, since birth control pills are metabolized in your liver, you can't take them if your liver is sick. But if you can avoid these deal breakers, you can take advantage of a bunch of other benefits of birth control pills. You aren't going to believe some of the positive things that birth control pills have to offer. You see, this is one of those areas where there are so many misconceptions, it'll make your head spin. So many women believe that birth control pills are dangerous and that they should stop taking them. And actually, the opposite is true. Birth control pills have more benefits than risks. You see, I don't know where people hear all these misconceptions that scare them away from beneficial things. So here is the list of the good things about birth control pills. Birth control pills can eliminate or improve all of the following: irregular periods, heavy bleeding with periods, anemia due to heavy periods, growth of fibroids in your uterus, PMS, premenstrual syndrome, mood swings, wait, I'm not finished, ovarian cysts, ectopic pregnancy, which is pregnancy in the wrong location, pelvic inflammatory disease, otherwise known as PID, non-cancerous breast diseases, and acne. And those are only the short-term benefits. There are some really significant long-term benefits too. Listen to this. Birth control pills decrease your risk of ovarian cancer by 50%. 50%, that's a lot. If you use birth control pills for more than 10 years, you can reduce your ovarian cancer risk by as much as 80%. Do you see why it's such a shame that misconceptions cause women to stop taking their birth control pills? And this 80% reduction in the risk of ovarian cancer persists for more than 20 years after you discontinue the pills. But the misconceptions commonly cause women to stop taking their pills before they've been on them for 10 years. Here's another long-term benefit. Birth control pills can reduce your risk of uterine cancer by as much as 70% if you use them for 12 or more years. And here's another one. They produce a long-term reduction in your risk for hip fracture. Oh, and there's one more. Birth control pills raise your good lipids and lower your bad lipids so that they decrease your risk for a heart attack. So imagine one pill that can decrease your risk of ovarian cancer, uterine cancer, osteoporosis, heart attack, and pregnancy. How is it that people only seem to know about the misconceptions? Now, just because birth control pills have a bunch of benefits, it doesn't mean that everyone should take them. Some people just aren't candidates for using them. There are always two sides to every coin. So what are the risks of taking birth control pills? Now see, these are the things you're probably aware of, because these are the side effects that are the scare tactics to prevent women from ever learning about the benefits. So the side effects of birth control pills include irregular vaginal bleeding, which is just irregular periods, blood clots, fluid retention or bloating, dark spots on your skin, nausea and vomiting, breast tenderness, changes in your appetite, headaches, nervousness, depression, dizziness, hair loss, rash, and vaginal infections. As with everything, you have to balance the benefits against the risks, both short-term and long-term, and make sure you're applying it to yourself. Okay, it's all about tailoring all of this to you, because no two women are alike. Now, let's switch gears to other forms of birth control. Not all birth control comes in the form of a pill that you take by mouth. As I told you before, when I was a resident in training, we had patients who were on birth control pills, but they still got pregnant. And when we asked them if they took their pills properly, they'd say, absolutely, I put one in my vagina every single night. See, it just goes to show that you can't assume anything. I mean, hey, if you get pregnant by putting a penis in your vagina, why not put your birth control pill in your vagina too, right? So let me clarify. Birth control pills go in your mouth. The methods we're about to discuss next don't. We're going to talk about birth control patches, which you apply to your skin, not to your eye, and birth control rings, which you put in your vagina, not on your finger. So here we have a birth control skin patch. Now this used to be called the Ortho Evra patch, but now it's generic and the new name is the Xulane patch. So what I have here is a patch, and as you see, it looks a little bit like a Band-Aid. And all you do is take one of these and stick it on your back or your upper arm, your stomach or your butt, and you put one patch on and leave it there for a week. Okay? Then, after a week, you take out another patch and you put it on some part of your body and leave it there for a week. And then you take a third patch and you stick it to some part of your body and you leave it there for a week, okay? One patch for each week. And then you go for 1 week without a patch, and voila, you have your period. So that constitutes the cyclic regimen. Or, if you're on the continuous regimen, you immediately open the next box of patches. One month of this skin patch comes with 3 patches in it, 1 for each week, and then you have 1 week off. But if you're doing the continuous, you use 1 box, which is 3, and instead of waiting 1 week without a patch, you just put on another one. You open another box, start it all over again. So you never go without a patch. You just replace one patch with the next so that you always have a patch on and there are no breaks. So you see, you can use either regimen, the cyclic or the continuous, with the patch just like you can with the pill. And next we have something called the NuvaRing. This is called a NuvaRing, and you can see that this is a soft deformable ring, and if you recall the tutorial on pharmaceutical estrogens, it looks kind of like those estrogen vaginal rings that we discussed in that tutorial, doesn't it? And since you insert this one yourself, like the estrogen vaginal ring, I thought it might be good to demonstrate insertion of this just as I would if you were a patient in my office. So what I have here is a little model, and this is a model of your pelvis. This is your belly, this is your butt, this is your vagina. Not yours, but you know what I'm saying. This is your vagina, and I'm going to show you how to put a NuvaRing into your vagina. So what I have here is a blue one so that you can see it, and it's fake. And all you do with this is you bend it, feed it into your vagina, and when you push it in, it's going to open up and just sit in the top of your vagina. And you won't feel it, your partner won't feel it, but you can see it in there. You see that blue ring off to the side? Maybe you can see it. That's the NuvaRing. So you put this in your vagina and you leave it there. And you leave it there for 3 weeks. And after 3 weeks, you reach in with your finger, remove it on the same day of the week that you inserted it, and voila, leave it out for 1 week and you'll have a period. So that is the cyclic regimen. Now, alternatively, you can take out your ring after 3 weeks and stick another one right in at the same time immediately, and guess what? That would prevent a period and it would constitute the continuous regimen. See how this works? Both the patch and the vaginal ring work exactly the same way as the birth control pills do, but there's one big difference. Patches and rings don't get metabolized in your liver. And what that means is passing through your liver is what increases your risk for blood clots. So this is a very big difference. This means that the patches and the rings don't increase your risk for blood clots. So yay! But you still cannot use the patches or the rings if you're a smoker, or if you've had a heart attack, or if you've had a stroke, or if you've had breast cancer. And the patches and the rings give you all the same short-term and long-term benefits that I enumerated for birth control pills. But there are some disadvantages. I mean, the patch could fall off without your knowledge. I mean, this could just fall off and you didn't notice it. And if that happened, obviously you could get pregnant and you wouldn't have your hormones. And I don't know about you, but I think that one of the most shocking risks is getting pregnant during your perimenopausal, when you think it's impossible, okay? So check daily to see that your patch is still in place. And likewise, the vaginal maneuver ring could fall out unexpectedly, but I mean, you're likely to notice it if it's in your underwear or your pantyhose, right? And unintentional expulsion from your vagina is very rare. I guess the biggest risk with the patch and the vaginal ring is forgetting to take out the old one and replace it with a new one. I mean, think about it. 3 weeks flies by. It's not like birth control pills where you have a pack to look at every single day, and the pack reminds you that you have to take your pill. These are things you have to remember in 3-week segments, and that could be a little bit difficult, right? So in the event that you forget to take this out, you run out of hormones and you can get pregnant, and of course your menopausal symptoms come back. It happens. Okay, so I'm sorry, I hate to end this with such an unsavory thought, but we are at the end of this topic. I just can't think of a way to put a positive spin on an unplanned pregnancy during perilous perimenopause. So to sum up what we have covered today, you might be able to use birth control for both pregnancy prevention and perimenopause management during the transition. And you may be able to continue using your hormonal method for the first few years of postmenopause. If you're looking for the absolute simplest, smoothest means of managing your menopause, this is definitely it. But you have to be a good candidate for it. And the myths you've heard about birth control being dangerous are untrue for most women. But there are some women who are not good candidates for birth control options for various reasons. Birth control pills, patches, and rings have some impressive short-term and long-term benefits, most of which are completely unknown to the vast majority of women. So that about does it. Now next time we're going to discuss the lower dose estrogen plus progesterone hormonal options, which of course are called hormone replacement therapy. So you'll get to see the difference between those and these. Okay, so until next week, I bid you goodbye. Stay like humble menopausal Barbie and not like horrible menopausal witch. Bye!